When we think about blood supply to the heart, the coronary arteries are the key. They're who is giving the heart blood. And I encourage you to follow along on this picture here or any of these number of pictures, images I have for you. I'm going to talk through them on this slide, but I'm going to kind of refer over to these images. So the right coronary artery is going to come from the right aortic sinus. So off of our aorta here, okay, so this is our aorta. We have the right coronary sinus here, and then flowing off of that right coronary sinus is the right coronary artery. Okay, so this is what we're talking about first. The right coronary artery, so you need to know where it branches from. You need to kind of know what might branch off of it and what it could potentially serve. So there is a SA nodal branch, which is right near the origin. There's also an AV nodal branch, and there's a right marginal branch. Now, the right marginal branch, which we can kind of see here, right marginal artery, is going to serve the right ventricle and the apex. And we can kind of see that in this image, right? The right marginal branch is, if we follow it, is kind of like flowing off down this front, down towards kind of the tip of the heart. There's also the posterior descending artery or PDA. This is what's serving the inferior IVS, intraventricular septum, the posterior ventricular walls, and the posterior medial papillary muscle. So we have the posterior descending artery here. Okay, so these would be the two key branches from the right coronary artery. So knowing right coronary artery, the two major branches, and what they serve, what tissues and structures they serve would be high yield anatomy info. The left coronary artery arises from the left aortic sinus. So we have the left aortic sinus here, and then we have the left coronary artery coming off of that, or our LCA. The left anterior descending is the anterior two-thirds portion of the interventricular septum. Also, the anterior lateral portion of the papillary muscle and the anterior portion of the left ventricle. So we have our LAD, left anterior descending, and we can see that it's kind of moving here and all the way down here. So we have that. The LAD is the most commonly occluded coronary artery. So if you remember one thing from a pathology perspective for anatomy, high yield, LAD, LAD. If there's occlusion, think LAD first, okay? The left circumflex artery is serving the posterior lateral left atrium and ventricle, as well as some anterior lateral papillary muscles. In 40% of people, the SA nodal branch actually comes from this instead of coming from the right coronary artery. So just keep that in mind. But the left circumflex, we can see, is passing kind of here, around the back, and here. So that's our left circumflex artery. And then we have the posterior descending artery. And this one is listed back on the back. It's listed kind of twice because it has coronary dominance. And what I mean by that is that typically people are right dominant, meaning it's coming from the right coronary artery. About 8% could be left dominant from the left circumflex, and 7% are co-dominant, meaning that this posterior descending actually like meets across both sides. So it attaches from both sides. It's co-dominant. So just keep that in mind. If you are forced to choose, right coronary artery is most common for the PDA. Now, when we look at venous drainage, we can kind of look here at these two images for venous drainage. We have the great, middle, and small cardiac veins. The great cardiac vein is going to be draining the anterior interventricular septum, and all three will drain into the coronary sinus. The middle cardiac vein drains the posterior interventricular septum, and the small cardiac vein drains the inferior margin. And so we can see here this great cardiac vein. We don't have, oh, then we have a middle, and then we do have our small. Again, small is seen here, middle, and then we don't really have a great picture of the great in this image. Maybe here would be the best picture of the great. So they all drain into this coronary sinus. What is that? Well, it's located in the left posterior atrioventricular groove, and it drains into the right atrium. And you can see this is the coronary sinus here. This is the coronary sinus there. So it's kind of the collection pot. Embryologically, the sinus venosus would be the embryologic derivative. And the anterior cardiac veins can drain directly into the right atrium. So there are some veins that can drain directly. Clinically, our coronary arteries are going to fill up during diastole when the heart is resting and filling, and they run just deep to the epicardium. They're embedded in layers or tissues of fat. The endocardium gets oxygen directly from the heart chambers. It doesn't need to pull oxygen from these coronary arteries. And the coronary sinus can get dilated in pulmonary hypertension because blood flow is essentially backed up. Near your study pictures. And then we're going to stop here. When we come back, we're going to look at what are the branches, the key branches off of our aorta.